Welcome to our video segment on autism. In today's installment, Stephanie Schneider talks about what communication components we assess and target at Red Door in the area of speech and language.
So when a child receives a diagnosis of autism, there's a language component involved, absolutely, no question. Some kids with autism have difficulty with just those core language skills. The content of their language, their vocabulary isn't where it should be. They're not able to understand language presented in their environment. Those things can be hard. They also have difficulty sometimes with the form of their language. So that refers to like grammar and syntax. Their sentences are simplified. They're not able to communicate things in a way that we would expect for their age with those skills. We also have children with autism that come to see us and we give them our language assessments and they score off the charts. They're within the average range or above the average range. So they have these awesome language skills. But it doesn't stop there for us because another big part of language is using your language. Now that you have all of these good skills, vocabulary and the grammar and all of those things, are you able to not only express yourself effectively when you're in group situations with other people, but are you also able to interpret other people's language correctly? And you know, we talk about language and the importance of the verbal part of language, but there's also nonverbal language, and it's some ridiculous percentage, like 60 to 80% of communication is nonverbal. And when I say nonverbal, I'm talking about gestures, posturing, facial expressions, body language. We say a lot of things without saying anything at all. So that's something that we would address as well when we're working with kids with autism.